Welcome to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati Spine procedures, Alfred Bonati, MD. Now here along with Dr. Bonati, your host, Kimberly Bermel.
Good afternoon, and thank you for joining us for American Medicine Today. This afternoon, I'm Kimberly Bermel, joined by executive producer of AM Tampa Bay, Ethan Euchre.
Good afternoon.
Thank you for being here. And to my right, I have our friend Jeff Wagstaff sitting next to me. Thank you for joining us.
Thanks for having me.
And again, world-renowned neuro and orthopedic surgeon, Dr. Alfred Bonati of the Bonati Spine Institute, world leader in advanced spine surgery. We appreciate you being here, sir.
Hello.
A man of few words.
Leadership is measured by innovation, experience, and success. And we're going to talk a little bit about the history. After researching back, neck, and joint pain for many years and finding poor results in unsatisfied patients, Dr. Alfred Bonati revolutionized the field of spine surgery. Dr. Bonati created, perfected, and patented minimally invasive laser spine surgery called the Bonati Spine procedures. He did so by applying new methods and techniques, including arthroscope, laser, and other instrumentations non-existent at that time. As part of the advancement of his particular procedures, Dr. Bonati developed a new set of treatments based on his work with the holmium YAG laser and received FDA approval for the use of that laser for the first time ever on the human spine as part of those patented procedures. Now keep in mind, until Dr. Bonati came along, there was only traditional invasive open spine surgery, and the patented Bonati Spine procedures are highly successful, and they consistently reflect over 94% patient satisfaction. The true patient-reported success rate is at 98.75%, and more than 45,000 successful procedures have been performed at the Bonati Spine Institute. Now, Ethan and Jeff, were you aware that in 1981, the Bonati Spine Institute was established in Hudson, Florida? That scenic, state-of-the-art facility, it sits on 11 acres. And
it's beautiful.
It is. And it contains its own imaging center, clinic, OR, and it offers access to those highly skilled registered nurses, orthopedic and neurosurgeons that make the Bonati Spine Institute a one-stop shop. Now, Dr. Bonati continues to lead the way in the study of laser technologies to treat cervical, thoracic, and lumbar spine problems. And, you know, if you've been a routine listener to our program week after week, you know Dr. Bonati's a strong advocate for patient rights and quality medical services and treatments.
Absolutely.
And you're all aware that nearly half the patients that come to us suffer from previous failed back and neck surgeries with other facilities. So Bonati truly succeeds where others have failed. And because of his vast training and experience and expertise, he has an eye for exactly targeting the root of the problems. And it's that in conjunction with those patented procedures and precise tools that he invented that made it possible to minimize surgery, scarring, anesthesia, and recovery time. He, along with his highly trained staff at the Bonati Spine Institute, are able to pinpoint and resolve the patient's problems. With that being said, on today's show, we have patient Angie Melius on the phone, and she received treatment at the Bonati Spine Institute. And we're going to speak to her in just a moment. And later in the show, we have Dr. Kenneth Shane. He's an assistant doctor, I believe, with the Moffitt Cancer Center here in North Tampa?
Yeah, he's one of the oncologists up at the Moffitt Cancer Center. If people didn't know, Tom Brokaw, it's very topical. Tom Brokaw was diagnosed with cancer. I guess he's known for 6 months, but he's just kind of coming out public with it. So, and he actually... we have a clip of him talking about it, and we'll get into we'll talk to the experts at Moffitt just all about it, and what Mr. Brokaw, one of my favorite anchors growing up, what he's going to be going through.
All right. Well, let's go to our guest on the phone, and her name is Angie Melius, and thank you for being here, Angie.
Oh, it's my pleasure.
Why don't you tell us, well, first off, you live in Georgia, correct?
That's right. I live in the mountains of Georgia, almost to the North Carolina line.
All right. Why don't you kind of walk us through what life has been like while you were, how long did you deal with your pain? What caused it?
It was a prolonged usage of my body as I installed computers and software and supported my customers with IBM. It went on for several years, starting way back in the 90s. progressively. I started having the back pain. It continued to get worse as I continued to work so physically. I've always been very physical since I was a kid. I would climb trees and roller skates and do all the kind of things that tomboys would do, because I really like being outside and being physical and doing things. And I guess as I progressed through all that in the years, I damaged my back. It was actually my thoracic part, the middle of my back. And the pain continued to get worse and worse. And I went from doctor to doctor, chiropractors, medicines, pain pills. That was no way to live for me. It just was not acceptable. I went ahead and went to, like I said, many doctors. I even went to the Emory School of Medicine in Atlanta, Georgia, to what I thought was the experts in back pain and surgery and helping people. And I was very discouraged when they told me there was nothing they could do for me. They pretty much sent me to a pain clinic and told me I was going to have to be in pain pills the rest of my life.
How did that make you feel?
I'm sorry?
How did that make you feel?
I became very depressed, and there was a point where I just felt somewhat suicidal because I couldn't garden, which was my passion. I love to garden and do all the physical things I've always done, and I couldn't even get out of bed. There were days that the only way that I could ease the pain was just staying flat in bed and not do anything, and it was just not good. It was just not good.
You got to imagine, Angie, that especially if you're going somewhere, you're from Georgia, you go to the Emory School of Medicine, which is supposed to be, one of these most prestigious universities. You think if anybody can help you, it would be these folks. They tell you, well, sorry, you're going to be on pain pills probably the rest of your life and still in pain. So that must have been extremely discouraging. So how did you end up just popping pain pills like candy because you were depressed and was told that was really all that you could do?
I was on antidepressants and all those other medicines are for other things, but it's supposed to help with pain. And it made me feel horrible. I couldn't do anything. And I was so afraid of becoming addicted to some of those pain medicines. And I just would not take it. So I was in pain all the time. My poor husband, he thought, I couldn't get out of bed. I couldn't do anything. I was really afraid even for my own marriage. And after I came out of the Emory School of Medicine and they told me that, I was in tears. I was just crying. And then I started thinking, let me research on the web and see if there's anything else I could do. And by God's grace, I came across Dr. Bonati, and I started reading all of how he was helping so many people. He created this new way of invasively helping back patients, and I got very encouraged, and I went ahead and sent in my MRI. And the folks there were very, very nice. They called me immediately, and they set up an appointment for me, which was very fast. I was very surprised. They were so encouraging. I went in there with all the faith that Dr. Bonati would be able to help me. He was actually my miracle. I call him my miracle because when no one else could help me, Dr. Bonati looked at me. He took great care in helping me, and the rest is history. I'm so grateful. I'm so grateful that I came across him.
Angie, looking at your medical history from the Bonati Institute, we see that you had 3 operations, 3 separate procedures in 2011.
Yes, I did.
After going through those procedures, tell us a little bit about what that did to alleviate your pain and the quality of life after having the Bonati procedures performed.
As I said before, I was in a lot of pain. The procedures I had, I was a complicated case. Not everybody could help somebody like me because it was in the middle of my back, not like the lumbar or the cervical spine. That's a piece of cake compared to what I went through. they were able to go in, and it took, as you said, 3 times, but they were able to pinpoint the nerves that were causing me all my pain. And while I was going through the surgery, it was a difficult time, but Dr. Bonati found the problem, and he fixed it. It took me a couple of weeks to recoup from all the, as I said, 3 surgeries in 2 weeks. That was quite a lot. That's why it took me so long to get over it. Now, my brother has just gone through a surgery, and his pain was alleviated immediately. He's actually able to walk that he couldn't do before. Mine was a little more complicated.
And Angie, you're not to interrupt. Your brother was also a referral of yours to Dr. Bonati, correct? Because he was also suffering from back pain.
Yes, he's a truck driver. He could not work because he had long hours to sit and drive the truck. And they had sent him to a pain clinic, and he could not work. He's taking those medications. So after a month suffering with this and not being able to work, I called the Bonati Institute, and they got him in right away. And he just had surgery on Wednesday, and it immediately alleviated his lumbar, the sciatica pain that he had. He's sore from the surgery, but he's doing great. Just like me, when after I had my surgery and I went back home and I recouped, I started once again doing my love, my gardening. I was able to have the prettiest yard in the whole neighborhood, as like the neighbors said to me one day, because I was digging in the dirt, digging all this stuff out, putting nice bushes in, and doing all the things that I love to do.
That's perfect. So Angie, let me pause you right there, because we actually we're up against a break, but we'll keep you to the next segment, kind of get what your life is like now after having the Bonati procedure done, okay?
Okay.
All right, so just hold on. Kimberly?
You are listening to American Medicine Today on News Radio 970 WFLA. As you just heard, we got somebody else back to participating in life. If you're suffering from head, back, neck, or leg pain, you can log on to Bonati.com or give us a call at 855-267-0482 or catch us after the break. We're going to hear more from Angie Melius, News Radio 970 WFLA.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail. The Bonati Spine Institute is proud to announce more than a 90% success rate in over 45,000 patent-protected spine surgical procedures. Call us today at 855-267-0483 or visit our website at Bonati.com.
All my pain is gone. Gone.
Today I am totally pain-free. Nothing. No after effect.
I'm pain-free, and I have had to take any pain medication.
Today I am pain-free for the first time in over a year, and it is so awesome.
I only wish I'd known about it earlier. Right now I am completely without pain.
Sitting here in this office right now, pain-free, eager to enjoy the rest of my life.
I am feeling great.
I feel 100% better, like a new person.
Today I feel absolutely fantastic. It's just incredible, the relief I feel right now.
Today I'm completely pain-free.
During the procedure, I literally felt the pain melt away. It was fantastic.
I feel so good.
It took care of my headaches instantly.
It's incredible. It's really incredible.
You gave me my life back.
It's just wonderful.
I feel fantastic.
It is just absolutely amazing.
So I'm hoping to be climbing hills in a few weeks.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati Spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Brumell.
Thanks for joining us again on American Medicine Today, brought to you by the Bonati Spine Institute. I'm Kimberly Brumell, joined by world-renowned neuro and orthopedic surgeon, Dr. Alfred Bonati. As well, Ethan Euchre and Jeff Wagstaff are here. Before the break, we were speaking with patient Angie Melius, and she was talking about how she was diagnosed with some thoracic issues, and she suffered with them for many years. And she went to a highly prestigious school in Georgia, and apparently they told her that there was nothing that they could do for her except transfer her to some sort of pain management group, and that left her
depressed.
Very depressed, suicidal.
So, I mean, in other words, she was told by one of the best, in quotes, medical schools in the country that there was nothing that could be done for her and that she was just going to have to manage her pain, live the rest of her days in pain. She was able to get in touch with the Bonati Institute, had a couple of procedures done, and even referred her brother to Dr. Bonati. He's apparently pain-free. Angie, you still there?
Yes, I am.
Okay, so just kind of bring us up to speed as to how your life is nowadays after having this done. Being told, again, that you would always live your entire life, the rest of your days in pain. How you feeling now after seeing Dr. Bonati?
I feel great. We're living in the mountains of Georgia now, and we can go hiking, we can go camping. It's wonderful. My yard, I look forward to gardening, and all I have to say is to anybody that's out there in pain, don't take no for an answer. Check Dr. Bonati. He is a miracle worker. He's giving me my life back. He is my miracle worker. And Dr. Bonati, thank you so much. I owe you my life. Thank you for giving it back to me, making it worthwhile living, and being able to do the things that I really enjoy to do. Thank you so much.
Thank you, Angie.
I appreciate you taking the time to share your touching story with us. You know, you're not the only one that has suffered in that way. I'm so glad that Dr. Bonati was able to help.
Continue to live pain-free, Angie, and I'm sure Dr. Bonati wouldn't say this. I'll say it for him. Let's continue with those referrals for any other family members that may be experiencing
pain.
Sure.
I have my sister-in-law possibly coming in also.
There you go. See? Everybody experiences pain.
Thank you, all.
All right. Thanks, Angie.
Thank you.
Thank you, Angie.
Jeff?
It's just amazing that we have spoken to so many people from different walks of life, from a lady like Angie, who was very active, to construction workers, to we actually had a physician here a few weeks ago. And the one common theme through all of these patients is they had pain that really changed their lives, that took their lives away. And to hear these people get their lives back and to see it is just absolutely unbelievable.
It's amazing. Well, moving on, we have a Dr. Kenneth Shane. He's an oncologist with the Moffitt Cancer Center in North Tampa. And for those that don't know, Tom Brokaw, beloved anchor, well, you know, to most people, I would say.
Very well respected.
Yes. Very well respected in the news industry, 74 years old. He was diagnosed with multiple myeloma. I'm probably saying that wrong.
Myeloma.
Myeloma. It's a type of cancer that affects the white blood cells in the bone marrow. And actually, Mr. Brokaw, he runs a segment here on the flagship of 970 WFLA here in Tampa. We have a clip that we'll get into here in a minute, but we wanted to bring Dr. Kenneth Shane on again from the Moffitt Cancer Center to kind of just talk about Brokaw and his prognosis and what the future has in store for him. So welcome to American Medicine Today, Dr. Shane. How are you this afternoon?
I'm doing very well. Thanks so much for having me and giving me the honor to talk about Mr. Brokaw and his disease, specifically multiple myeloma. It's a great pleasure. Thank you.
You got it. So tell us a little bit about this disease, how one gets it, how one can prevent getting it, and what the prognosis is for Tom Brokaw moving forward.
Sure. I mean, there's a few things we need to kind of think about. One is that obviously we don't know Mr. Brokaw, all of the details of Tom Brokaw's disease, so we can't get too far into speculating on his outcome, etc. But what we can do is talk a little bit about multiple myeloma at first, which is a disease, as you said, of a specific part of your immune system or the white blood cells in your body called a plasma cell. And these are cells that live in your bone marrow, which is that soft part inside your bones where all the red cells, white cells, and platelets are all made. And what happens is one of these cancer cells, or one of these cells, a plasma cell becomes and starts growing out of control and becomes a cancer within the bone marrow, taking up space and causing significant issues in terms of your ability to make the other cells, the white cells that fight infection, the red cells that carry oxygen, and the platelets that help you clot. And they get pushed out, and those cells drop in numbers. You become anemic, so you become fatigued or tired. But myeloma does more than just that, unfortunately. It can also cause significant issues with bone health. So your bones become weak, and they can fracture. It can cause kidneys to fail, and it can cause electrolyte abnormalities like hypercalcemia or high calcium levels. It can cause a number of problems, including mental status changes, arrhythmias, and the like. Most people present with fatigue or sometimes bone pain or infections because of this disease, and that's how it's identified. And others get found kind of spuriously. They see their primary care physician, and they have some abnormal labs because these cells also make an abnormal protein that you can find in your blood. Now, it is a disease that typically, to kind of give you a feel about what the disease is, it targets mostly people who are in their 60s, 70s. The median age is about 69 to 70. About a third of patients are over 75 years old. That doesn't mean it doesn't afflict people who are in their 20s, 30s, 40s, 50s, but to a much lesser extent. It's a disease that we really don't know what causes it. There are a lot of things that have been linked to it, including high doses of radiation. So think about Chernobyl, Hiroshima, those kind of things. There are some studies that suggest maybe certain organic solvents, detergents might be linked to it. There is a study that suggests that the younger individuals at ground zero after 9/11 might have a slightly increased risk, but again, nothing concrete. And we continue to try to figure out different ways in which we can link either genetic issues or not. Again, generally it's also a spontaneous disease, meaning that it isn't really passed from family member to family member, although sometimes it can be. To talk about what Mr. Brokaw is probably going through is that he was actually diagnosed back in August. Has probably been through therapy out at Mayo Clinic. I think he's in Scottsdale, Arizona at the Mayo Clinic there, receiving great therapy from those folks. But the disease is, one, it's a serious disease. It's a disease that we don't today have a cure for. And so it is a mortal disease. But the good news in that setting is that we've made great strides in the last 2 decades or plus that allowed us to give very good drugs that are very, very efficacious or effective in terms of controlling disease and provide long-term great outcomes.
Excellent. Hey, Dr. Shane, if you don't mind hanging on just for a quick minute, we'll extend it into the next break. I have a clip of Mr. Brokaw addressing his state of mind and things like that. I also think, having heard the clip, it's a good message for people who have cancer and are going through cancer. And we'll just quickly pick your brain as far as the prognosis and just get a wrap up. Okay, so if you don't mind hanging on.
Absolutely.
Dr. Shane from the Moffitt Cancer Center. Kimberly, how do people get in touch with the Bonati Spine Institute?
Well, if they're local, they can come down to US 19 and Hudson Avenue. Give us a call at 855-267-0482. We'll hear more from Kenneth Shane on the flip side of the break.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail. The Bonati Spine Institute is proud to announce more than a 90% success rate in over 45,000 patent-protected spine surgical procedures. Call us today at 855-267-0483 or visit our website at bonati.com.
All my pain is gone. Gone. Gone.
Today I am totally pain-free. Nothing. No after effect.
I'm pain-free, and I have had to take any pain medication.
Today I am pain-free for the first time in over a year, and it is so awesome.
I only wish I'd known about it earlier. Right now, I am completely without pain.
Sitting here in this office right now, pain-free, eager to enjoy the rest of my life.
I am feeling great.
I feel 100% better, like a new person.
Today I feel absolutely fantastic. It's just incredible, the relief I feel right now.
Today I'm completely pain-free.
During the procedure, I literally felt the pain melt away. It was fantastic.
I feel so good.
It took care of my headaches instantly.
It's incredible. It's really incredible. It gave me my life back.
It's just wonderful. I feel fantastic.
It is just absolutely amazing.
So I'm hoping to be climbing hills in a few weeks.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati Spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Brumell.
Thanks for continuing to listen to American Medicine Today, presented by the Bonati Spine Institute. I'm Kimberly Brumell, joined by world-renowned orthopedic surgeon, Dr. Alfred Bonati, Ethan Euchre, and as well Jeff Wagstaff of News Radio 970 WFLA. Before the break, we were talking with oncologist Dr. Kenneth Shane from the Moffitt Cancer Center in North Tampa. He was speaking to us a little bit about myeloma, and that's the bone marrow disease that Tom Brokaw, 74, was just diagnosed with, and he came out with a statement earlier this week. Dr. Shane, do you want to continue telling us about some of those risk factors?
Sure. I mean, I'll tell you, I think one of the things you might want to know a little bit about also is the fact that there's a really nice outcome these days in terms of patients with multiple myeloma, which I think will be really important to listeners, and especially in the setting of Mr. Brokaw's diagnosis and therapy. And I think it's kind of put it in perspective, if you don't mind, is about 10 to 15 years ago, if someone came into my office and I would have said that the median overall survival for myeloma is really 2 to 3 years, which is not a real long period of time. But because of a lot of the research that's been done in places like Moffitt and Mayo Clinic and other places across the country and the world, we made huge strides in that, where we can push that median overall survival, meaning people who live at least that long and sometimes less, to about 7 to 8 years. And in fact, based on certain risk stratifications, risk criteria, we can really divide people into patients who can live greater than 10 years, those around 7 years, and those in less than 2 years, unfortunately. There's still a large group of people we don't do a great job with, but we're trying to continue to work on that. So just to kind of give you a flavor of what we think Mr. Brokaw can expect is hopefully a good quality of life and a good lifespan even with this mortal disease. I think it's just critical to kind of understand in the setting, and the therapies we use today are generally very well tolerated.
Yeah, that's what I was going to ask, Dr. Shane. What are the treatment options for Mr. Brokaw? And I understand a lot of, especially when it comes with bone marrow, unless I'm mistaken, I've heard that it can be very painful, some of the treatment for this.
Yeah, for him, so right now he's probably in the middle of what we call primary therapy or induction therapy, which is, again, getting his disease under control, hopefully having the best response we can, taking it to almost where we can't measure the disease. Then typically there's a second line of therapy called consolidation, which involves a bone marrow transplant, which is essentially for myeloma or multiple myeloma, a way in which we can give patients high doses of a single chemotherapy called melphalan. And the transplant actually just is a way for us to protect him from the doses of drugs. So we take his cells out, his stem cells, give him the drug, and then give his stem cells back. And the cells go back in and repopulate, and his white cells, red cells, and platelets come back to normal levels, while at the same time we've destroyed hopefully as much of the disease as we can. Again, we can't destroy it all, but as much as we can. And this technique allows us to get improved overall survival and control of disease for longer periods of time. And then after that, even there's another kind of maintenance therapy, which is a low dose but continued therapy. And this, again, is speculation. I can't tell you what his physicians are planning, but it's generally how we would approach someone who is transplant eligible, someone who's able to handle these kind of things. At 74, Mr. Brokaw is kind of on that fence where it may just be therapy without the transplant, just because of the nature of transplant. But my anticipation is his announcement came right about the same time he would be going under transplant, so that's kind of what I think might be the next step in his disease care.
Dr. Shane, I just wanted to jump in. Earlier in the previous segment, you had mentioned there's different detergents. Are you talking about everyday detergents that all of us use?
No, these are things like, things you'd use for out on oil rigs or, heavy detergents. And even then, these are not things like soap or hand sanitizers, things like that. No, nothing like that. These are benzene detergents, kind of nasty things that you wouldn't want to be on your skin at all.
Interesting.
You wouldn't think Mr. Brokaw would be working with those in the newsroom.
Yeah,
no, definitely not. Again, there are links to it. They're not direct causes, and that's why I kind of caution all my patients is that I really can't tell you what caused this disease, and even if you were associated with this or that, I really be able to say for sure that's what caused it. It's generally a spontaneous issue where, for reason X, Y, or Z, a mutation happened or a genetic change happened in some of these plasma cells and caused it to become to grow uncontrollably in your bone marrow and start wreaking all this destruction in there.
Well, very interesting. I'm glad you were able to share some enlightenment on the whole issue here. Dr. Kenneth Shane, oncologist at the Moffitt Cancer Center. More information on Moffitt at moffitt.org, one of the nation's preeminent places as far as oncology goes. So definitely want to check them out, and appreciate you joining us on American Medicine Today, Dr. Shane.
Oh, absolutely. My pleasure. Thanks so much for inviting me and having me. Let me discuss an icon like Tom Brokaw. Thanks so much.
You got to have a great day. And speaking of Brokaw, we got this clip here, which he actually has a segment called American Stories that he airs on the flagship here in Tampa, 970 WFLA, and he addressed it on Friday. Here's the clip.
You may have heard this week that I've been diagnosed with cancer, multiple myeloma. That's a cancer of the blood cells in the bone marrow. I've kept the news private for 6 months and hope to continue my encouraging treatment away from the spotlight, but I do have a few thoughts to share on how to deal with friends who have cancer, and we all have those friends, don't we? Don't call repeatedly to ask, how are you? Instead, call with a joke or some gossip. Send a funny YouTube. Send over 4 quarts of ice cream or a large container of chili, music, or a book on tape. If your sick friend has kids, take the kids on an outing. Cancer is a full-time occupation for those affected. They don't need to be reminded that they're sick. They do need to be reminded they're not in this alone.
Absolutely. Absolutely, and that's I think that's great advice for anybody who has friends or relatives fighting cancer. Just because it's they know they're sick, they don't have to keep being reminded that they're sick. So just be there for support.
Absolutely.
And don't shy away from them. That's the time when everyone needs to pull together.
Absolutely. Well, I guess it's time for our favorite segment of the day, Dr. Alfred Bonati and What's New in Medicine Today.
Let's look at what's new in medicine today, featuring Alfred Bonati, MD.
Well, I was thinking very seriously on some of the different types of problems that happen in the country. And one of the things that is happening very, very frequent now is we listen to people that they are in a depressed mood. It's an enormous amount of increase of people that they are suffering of depression. The depression levels in the antidepressant medication, they jump around 400% increase in young people between 18 and 44 years old. What is that? Why that happens? Well, let me go back a little bit of some history of my own life. When I travel around the world, and I went to countries that they are managed by situations, political situations like a socialistic or communistic countries. Did you ever see in television the faces of the masses of these people? Did you ever look at these people? They look sad. Mm-hmm. that look age for their own years of existence.
Absolutely.
They also look scared. They look all the time over their shoulders. They cannot talk too much because they're scared to talk. Now, all the abilities of these people are being destroyed. Why do you think that happened? Well, that happened because the people lost their all self-respect. The people lost their jobs. When you lose your job, you lose self-respect. And when you lose self-respect, you become depressed. The number of depression in this country is being unsurmountable this time. And it's because the Democrats are creating slavery. And that slavery is what is creating people who cannot survive by themselves. So they're dissatisfied, they're angry, they're upset, they cannot produce. Their possibilities of increase their abilities are being cut off from the root. So these people live by help of the government. What a sad thing. Come to United States, the best country in the world, or born in United States, the best nation in the world, and start to be an individual who accept the government to support you. What a disaster.
And that's a look at what's new in medicine today with Alfred Bonati, MD.
Well, thank you, Dr. Bonati.
There's a lot of, he touched on a lot of things there that set off some things in me, actually, as far as just the levels of depression now and things like ADHD and how much of that do you think, Dr. Bonati, is made up in pseudoscience and things like that? And how much of it is actually real? I mean, I know people, depression runs in my family, which is why it sort of hit home to me. So it's real, but I think some people, they have a bad day and they think, oh, I'm depressed. No, depression goes much, much deeper than that. So there's real depression, and then I think that there's people who just have a bad day and want to get some medicine for it.
Well, if you are being cut off in your possibility to perform in this life, you are 30, 40 years old with all this enormous energy, all these hormones telling you you can conquer the world, and somebody comes to you and say, you need to be in line to get your next payment, I will be depressed.
Yeah. So a political system can certainly to lead to that, especially slavery, as you call it, which you tend to think we're headed for. We can probably get into more of that in the next segment. I know Jeff actually had a story that he wanted to relate along the lines of what we were speaking about with the oncologist. It's kind of a cancer scare. Luckily, it turned out well. But Kimberly, as we come up against our break, how can people get in touch with the Bonati Spine Institute?
Well, they can reach out to US 19 and Hudson Avenue. Come visit us. They can call 855-267-0482 or visit us on the website.com. After the break, we'll have more with Dr. Bonati and Jeff on 970 WFLA.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail. The Bonati Spine Institute is proud to announce more than a 90% success rate in over 45,000 patent-protected spine surgical procedures. Call us today at 855-267-0483 or visit our website at bonati.com.
All my pain is gone. Gone. Gone.
Today I am totally pain-free. Nothing. No after effect.
I'm pain-free, and I have had to take any pain medication.
Today I am pain-free for the first time in over a year, and it is so awesome.
I only wish I'd known about it earlier. Right now, I am completely without pain.
Sitting here in this office right now, pain-free, eager to enjoy the rest of my life.
I am feeling great.
I feel 100% better, like a new person.
Today I feel absolutely fantastic. It's just incredible, the relief I feel right now.
Today I'm completely pain-free.
During the procedure, I literally felt the pain melt away. It was fantastic.
I feel so good.
It took care of my headaches instantly.
It's incredible. It's really incredible. You gave me my life back.
It's just wonderful. I feel fantastic.
It is just absolutely amazing.
So I'm hoping to be climbing hills in a few weeks.
You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati Spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Brumell.
Thank you for listening to American Medicine Today. I'm Kimberly Brumell, and thanks for joining us during the break, and this is why I'm kind of laughing. We were discussing twerking. I am totally out of the loop. I don't know, but let me contain myself. I'll intro everyone back in.
Well, the reason, just quickly, why we were talking about twerking and why I said some of the best stuff happens off the air is you were discussing how we have TV cameras in here now.
Yes.
And we'll get into the show and describing about the TV show in a little bit, but you said, hey, you know, if we run out of things to talk about, we can just dance. And I said, well, you can start twerking, and you almost spit your water all over the screen.
I've heard that word. I have no clue what it means.
And then our videographer, John, over here said, of all the people in the room, he goes, I know what it is, and he starts twerking.
And what's even worse is that world-renowned neuro and orthopedic surgeon, Dr. Alfred Bonati, knew what it was. I hadn't a clue.
I think Dr. Bonati's been on YouTube watching Miley Cyrus doing a little twerking.
I don't blame him. I really don't blame him for that.
I was twerking.
He's a twerking professional over here.
That's it.
Well, just to reset, we were talking about Tom Brokaw and you know how he was diagnosed with cancer earlier this week. Well, months ago, but he came out this week that he has cancer. And Jeff was relaying an interesting story again off the air about your own little cancer scare. I think a lot of people can relate to this, Jeff.
A few years ago, in my annual checkup, got a call back from my primary care physician who, first of all, I never get a call from my physician, who after I'd gone in for my annual checkup, his office had called and set up a follow-up appointment. So when I went in, I met with the doctor. It was late in the day, and we didn't meet in an examining room. We met in his office. And he explained that after going through a very in-depth annual physical, that he had noticed I had elevated white blood cell count.
Which is typically a sign of cancer, correct?
Correct. And it was slightly elevated.
Because it means that your body is trying to fight off something, because all of a sudden you've got way too many blood cells, and the blood cells is what gets rid of
And I hope I explained
infections.
this correctly, Dr. Bonati, but the way they explained it to me was it was either an infection, flu, some type of an infection, or a sign of something going on that could be like cancer. So
nobody wants to hear the C word.
No. And out of an abundance of caution, he referred me to an oncologist. So the very next day, after hearing something like that, of course, I called to make the appointment. And the thing that I don't think people realize is when that doctor tells you that you could have cancer, it is unbelievably devastating.
It's a punch to the gut, absolutely.
You know, I'm married. I've got 2 kids.
You're still young.
Yeah, I'm a fairly young guy, very, very healthy. So to say I was a little shook up would probably be an understatement. But the very next day, I called the oncologist, and the young lady that answered the phone, and at the time I was living in Orlando, the young lady that answered the phone answered at Cancer Center. And I couldn't speak. I didn't know what to say, and I just hung up the phone.
Wow.
Now, being frank, when I heard her say Cancer Center is when it hit me. I was home.
Everything probably starts going through your head. I mean, you know, what could it be? What's my life? How's that going to change? Is it going to end?
Frankly, I was shook up when I talked to him, when I came home and explained to my wife what had happened, and Teresa and I talked about it. Something I need to look into. But when I heard her utter those words, I hung up the phone, and it hit me like a ton of bricks. And I sat at my desk like a baby and cried.
Normally,
I was scared and it hit me all at once. Mm-hmm. So after 10 or 15 minutes, I kind of got my act together, went to the bathroom, wiped off my eyes, and called her back. And first thing I did is apologize for hanging up on her. And she was great. She said, "It's okay. I understand. You're not the first person who was a little shocked when they heard those words." But over the course of the next year, the Cancer Institute that I went to in Orlando did a series of blood tests. For the first 3 months, I had my blood taken every week. Then, actually, the first 3 weeks it was taken every day. Then for 3 months it was taken every week.
So you had to go get blood drawn every day.
Every day for the first 3 weeks.
Brutal.
Then for the next 3 months it was weekly. Then for 3 months it was monthly. And what they were doing was establishing a baseline. Mm-hmm. Well, out of all of that baseline, what was determined, by the grace of God, is that it just so happens that my body has slightly elevated white cells. Something that I might need to keep an eye on in the future, but there was no diagnosis.
Wow.
But going through that process, and quite frankly, it's been 6 or 7 years sitting here telling you about it, kind of giving me the heebie-jeebies just thinking about it. But to go through that process and to hear that and to just think, how could it affect my ability to live, my ability to be a husband, to be a parent, to work, it was devastating. So we have talked to so many people with just unbelievable pain. Mm-hmm. I can imagine, like when we talked to Angie a little while ago, she felt like her life was over. She was devastated. And to have the ability to watch Dr. Bonati and his team to be able to take people who, like Angie said, her life was over. She was pain management. We'll give you pills. Mm-hmm. Dr. Bonati and his team gave her life back.
Absolutely. Fixed her.
And they gave her hope.
Mm-hmm.
That was the biggest thing. Jeff, like you, I went in for just a routine yearly physical, and all of a sudden I get a call at work, and I answer the phone, and it wasn't even a doctor. It was a nurse, and she said, "You have cancer."
What?
Yeah. Mm-hmm.
Just out of the blue.
I out of the blue, right? Wow. And so I remember just your throat tightening up and just like, huh? And then she hung up, and I just sat there, and I couldn't function. I went in and I told my boss, and he said, "Go take some time." And I remember crying and being scared, and I didn't want to upset my family, so I didn't say anything. And then they scheduled me to come in and go through a test, and I went through, and everything came back fine. And they said, "We apologize. The person shouldn't have said that. They should have said, could be precancerous," but it scared the daylights out of me. I was in my early 30s. I thought, my God, I'll never have a baby if I can ever, you just start contemplating life and all those things either you have or haven't achieved. And what if it is cancer? What's the outcome? And I remember being scared so completely. So I completely understand, Jeff. And like the people that have heard there's nothing that can happen for them, that they're going to have to live in pain, you hear it week after week on this show, that there is hope. And Dr. Bonati and the Bonati Spine Institute, along with highly skilled surgeons there, are able to help you.
Yeah, and if people want to get in touch with the Bonati Spine Institute, how do they do so, Kimberly?
They can drive out to US 19 and Hudson Avenue. They can take a walk right in. They can give us a call at 855-267-0483 or visit the website at bonati.com. New and exciting, tune in 7:30 p.m. Saturdays. Watch American Medicine Today on WFTS. Thanks for tuning in. We'll see you next week.